Bullshit.
It's the No BS Marketing Show. I'm Dave Mastovich, CEO and founder of Massolutions, the world's only no bullshit marketing agency. You've all heard, read, or watched stories about the COVID-19 vaccine. Some of you might have even been vaccinated. The subject of the COVID-19 vaccine generates social media chatter, discussions, and debates. Well, some University of Pittsburgh health scientists conducted research about social media campaigns around the vaccine issue, and they published their findings in the journal Vaccine. To talk about storytelling and picking the right channel, the journal Vaccine to tell research about vaccines. Lead author Beth Hoffman, a doctoral student at Pitt's Graduate School of Public Health, outlined 5 guidelines around how to communicate about vaccines. Before we dig into the findings, let's walk through why the study was conducted in the first place and how it ties back to no BS storytelling. Back in 2020, social media campaigns were launched to oppose the vaccine. When some healthcare clinicians were threatened, social media personality Zubin Damania, known as Z-Dog MD, called on healthcare professionals and vaccine advocates to speak out in support of vaccines using the hashtag #DoctorsSpeakUp on March 5th, 2020. Now this is where it gets interesting and shows the power of storytelling regardless of your views on the vaccine. Hoffman and the Pitt research team collected publicly available tweets with the hashtag #DoctorsSpeakUp that were posted on March 5th, 2020. It amounted to a total of 106,275 tweets, of which 19,332 were original. The researchers studied a random sampling of the tweets, looking at the type of account it came from, whether it was pro or anti-vaccine, and whether the tweet gave a personal narrative or made statements about research, or both. They found that 78.9% of the tweets were anti-vaccine. 78.9% of the tweets were anti-vaccine, despite the event being organized as pro-vaccine. Now get this, only 5.4% of the tweets came from bots or automated accounts, which is a low amount based on past studies and common sense. Hoffman and her team took this information and created guidelines for future pro-vaccine events. But really, these tips are tied to leveraging the power of storytelling. I'm paraphrasing, combining, and condensing the recommendations, but I'll have a link in the show notes if you want more specifics. First recommendation, combining. Share personal narratives, cite research, and leverage partnerships. My Seinfeld storytelling approach has 3 parts. One of those parts is that stories are about people. That's what those guidelines are saying. Make those stories about people. Next, maximize inclusivity. In other words, make it about them, your target market. Maximize inclusivity, another no BS storytelling mantra. Share a list of suggested tweets and train event participants. Take the time to plan. Map out your content. Leverage the 100-day activation planner by doing pre, during, and post-event storytelling. The anti-vaccine group leveraged the power of storytelling, that's for sure. They were a much smaller group, estimated in the 20% of the population range. But they overcame that by having a storytelling plan and working it. They knew that they could spread their story on social media and mobilize their supporters on the day of the vaccine event. Storytelling is the one tool that's been passed down from generation to generation, regardless of culture and regardless of where you stand on the issue. It's how we educate and motivate. Leveraging its power is a must for effective leadership and communication. Thanks for listening to another episode of the No BS Marketing Show, recorded here in our studio in bold, beautiful downtown Pittsburgh, Pennsylvania. Remember, ask yourself, what's the big idea? and build your story around the answer. It's all about bold solutions, no BS.